Yeah, I was not too long ago, introduced to the association, and this experience this time around as a sponsor has been nothing but wonderful. An incredible, energetic executive group that has vision, has traction. They have 300 members certified in such a short period of time. They're nationwide, and I think anybody that does any healthcare delivery, not just healthcare, but in their case healthcare, in remote and First Nations communities, sometimes the rate limiting factor becomes skill and capacity building on the ground. And we were always looking for partners that we can support, that can help train, help accredit, help standardize policy, procedures, delivery of medicine, because that's what we're so involved in. And I think there's, from what I experienced firsthand here, it seems like this is an amazing group and an organization that would allow us to reach out to those communities. And anytime we wanted to educate or train, I'd love to continue to partner with them. You hit it, Don. We're not technology. We're not a tech company. We're not a hardware provider. We're the physician services providers, and we look for solutions that are that we can integrate to allow for good workflow, for implementation, for the heavy lift, if you will, and that's what we do for First Nations. So, telemedicine, telehealth, e-health is not a new concept. It's a struggle globally, not just here in our communities, to actually make it work, to make it efficient, to make it sustainable, heaven forbid, one day profitable. And those are the models that we work in. Can we make it so that physicians can uptake telemedicine, that the workflow doesn't disrupt their model of medicine, nor the First Nations, and on the ground, the health directors and the nurses and so on that do the work every day. How can we help First Nations? We believed, I'm from the North, I provided personal health care in remote communities and still do. That the nation build, the community build approach is usually the best. We've seen that today in many workshops. That's some wonderful projects on community wellness programs being showcased over these last couple of days, and that's really where we can help, where we can go in and customize offerings. Not so forget telehealth. The idea is what health services are missing, what are the gaps, and what do they need. That'll be very different in one community up north to another community. Might be more urban, one may be more geriatric based, one might need more prenatal care or mental health. So the idea is, look at it as a one community at a time. I've been very fortunate to be introduced. I think the networking here is wonderful. I think the value in partnership is throughout the organization. I think everybody who joins the First Nations Health Managers Association, I think they really get it. They understand the value in the networking, the collaborative transfer of education and knowledge, and so without working too hard, if you will, we had the ability and were introduced by the executives to all the different, whether it be First Nations health councils and so on, regional leaders in thought to the different provinces. So I can only share a positive experience. I think it should not just be in my case, but I think a lot of the other exhibitors and so on would probably share the same story with you. And so to me, this is a great event, and the energy and the growth are kind of the underlying themes. And for me, as a company, Live Care, we thrive on it. We're in an exciting space. It's disruptive, it's growing, and to be surrounded by people who think in the same positive manner is always a great thing. And so please look us up, Live Care, livecare.ca, and I'd love to continue our partnership.